Okay, so hi, my name is Chloe. So today I'm going to be talking to you about my practicum experience that I experienced through the past couple months. So I was able to complete my practicum at RVH, which is the Royal Victoria Regional Health Centre in Barrie, Ontario. It's a hospital. It doesn't sound like one, but it is. So I was able to complete my practicum within the Simcoe Muskoka Regional Cancer Program, along with an Aboriginal patient navigator who works within the program. So just a little background on RVH. They are known to deliver high quality advanced care for all patients. They have been doing so since 1987. With their philosophy surrounding patient-centered care, RVH is able to offer care with a variety of medical subdisciplines, one of those including oncology, which is where we find the Simcoe Muskoka Regional Cancer Program. So the Aboriginal patient navigator is who I was able to shadow and learn from throughout my time. Some of their responsibilities include providing culturally and spiritually relevant support for Aboriginal patients, as well as their family members, any community members, and any other affected members. Coordinating traditional and non-traditional community resources and healings, counseling and supporting before, during, and after any clinical appointments, and being a liaison between healthcare teams, patients, and their families. So anyone who's been given a cancer diagnosis in the Barrie area that is of status can go to the Simcoe Muskoka Regional Cancer Program and speak with the Aboriginal patient navigator to help with any of these resources. So the case that I was able to identify through my time here was the need to transition to a trauma-informed approach for all Aboriginal patients. The issue within the healthcare system currently being provided is that there is very little support and incorporation of the impact of trauma. So by incorporating trauma-informed approach, it will allow for further development and improvements within the cancer care sector for all Aboriginal patients to receive better health outcomes. And by doing this transition, Aboriginal patients can have a stronger outcome, and it will minimize the chance of any I can't say this word in English, traumatization for Aboriginal patients. Okay, so the trauma that is being seen is by historical and intergenerational trauma. That is from the force of attendance from residential schools and caused loss of culture, family, language, and identity. So my role within the Simcoe Muskoka Regional Cancer Care Program was to contribute and assist with providing culturally relevant information and support. I was able to participate in the planning and the implementation of projects. I was also able to expand my current knowledge regarding the significance and meaning of providing culturally appropriate care for Indigenous patients. And I was also had the opportunity to assist in the collection of patient feedback for evaluation programs. So some of the skills I was able to apply while doing so was obviously culturally safety and competence. I was able to incorporate qualitative and quantitative research literature. I engaged in interprofessional teamwork and integrated evidence-based literature. And then some of the values were partner with people and population served, and then I was able to include diversity and cultural safety again, and collaborate action across all sectors. And then some of my practicum outcomes, there was a lot, but I just kind of tried to narrow it down. It's a lot harder to do. So I was able to develop a greater personal understanding of the effects of cancer on Aboriginal patients. That was a big one for me. I was able to develop and understand the barriers of healthcare that Aboriginal people face. I was able to observe and learn from a team of interprofessionals who are working to provide culturally safe care. And then my increase of appreciation of the work being done was a big one as well. So key insights was that this was a remarkable experience for me. I was able to grow personally and intellectually, both And it was really meaningful having the experience just to work alongside the patients and listen to their stories. And I'm out of time, so thank you. Yeah, that's it.
Thank you, Chloe. That went really fast.
Yeah.
You think so too?
Yeah, I do. 5 minutes is not a lot.
Okay, questions for Chloe?
Thanks, Chloe. I was wondering if you could give an example of a practice that would fall under the trauma-informed approach.
So the trauma-informed approach, what they want to do is they want to reduce any factors that could re-traumatize someone who has already been traumatized in the past by historical events. So doing so would just, with my experiences, the appointments that the cancer patients go to can be very, not hostile, but very nerve-wracking for them just because of the trauma they face. So it's kind of adding their culture into their care that they're receiving to make it more comfortable for them, if that makes sense. Yeah. Okay.
One more question? Trevor? No questions for Chloe? Okay, you're off the hook too.
Thank you.